Well, hi, my name is Paul Scortino. I'm from New Orleans, Louisiana, and I'm an architect. Also have an engineering background, engineering degree and architecture degree from Tulane University. And I'm also an ordained minister. I ministered in the prisons of New Orleans for about 7 to 8 years and saw a lot of positive changes in the inmates that made commitments to Christ. My eye surgery history is that about 25 years ago I was extremely nearsighted, and I had radial keratotomy performed on both eyes and had very good results. I was seeing 20/20 in both eyes and everything was fine until my early 50s or late 40s, when the presbyopia began to occur in my eyes, the stiffening of the natural lens. And then my vision started to get poor over a period of 3-4 years. I ended up with, because of the progression of the RK surgery and the presbyopia condition, I was farsighted in both eyes and needed glasses for distance and stronger glasses for reading. It impaired my work as an architect. It impaired my work in the field, supervising construction, and also doing the close work of reading and drawing plans and computer work. I sought help from several local doctors in New Orleans, and they made comments like, well, you're seeing good enough now, just leave it alone until your cataracts get really bad, and then we'll talk about doing something. So they essentially didn't want to do anything. And I was not comfortable. I wasn't confident in my daily activities with the farsightedness and slight cataracts in both eyes. I began to do research and additional research over a period of about 6 months, and I came across Dr. Gulani's website, which specifically dealt with treating patients who had previous radial keratotomy. I was encouraged. I saw the testimonials of several of the individuals who had similar conditions that I had and had great results. They reported 20/20 vision in both eyes. They told me about the individual care that Dr. Gulani provided for them and their families, and took the time to educate them and prepare them for the surgery. It's difficult for somebody to understand what the psychological conditions are when you're in my situation, and not many people seem to be able to relate to that. I could not wear contact lenses because my corneas were flattened due to the radial keratotomy, and the shape was wrong, so I was stuck wearing glasses for near and distant vision. So after listening to several of these testimonials, I was encouraged to contact Dr. Gulani's office, and in February of 2015, we visited his office, met him, and I was immediately impressed by his confidence, by his individual care, his willingness to communicate and explain my condition and the options that were available to treat my condition. So I was encouraged, yet I had a very, very busy work schedule and could not leave New Orleans for a period of time for the surgery and the recovery. So I waited about 1.5 years, and then we scheduled an appointment to see Dr. Gulani and to have the treatment that he prescribed for me individually. Like he said several times, no eye is the same, no patient is the same. So after significant analysis and measurements and by his staff and by himself, he came up with a unique methodology to treat my eyes. And that was performed 2 days prior to this video being made, and after 2 days I'm seeing very well in the right eye, which was treated, and in about 4 to 6 weeks I plan on having the other eye treated. The surgery went smoothly. The hospital staff was excellent. Things were made easy for me. All we had to do is show up at the hospital. Post surgery, Dr. Gulani's office, I met several times for additional examinations, and everything went extremely well. I'm seeing very well in my right eye, and like I said, just after two days after surgery. He explained to me that my eye will continue to improve over the next several weeks, at which time I plan on having the second surgery done. My recommendation to anybody with similar or any type of eye condition is to contact Dr. Gulani's office, to visit him. He'll take the time to explain the condition, and you can feel confident that he'll give you the best personal care and the best specific recommendation for treatment of your eyes. When my wife and I visited Dr. Gulani's office, I was impressed to learn that there were patients there from all over the world, from different countries. Some flew in. In my case, we were able to drive in. It was only about an 8-hour drive from New Orleans, Louisiana. So he's world-renowned and has treated hundreds, if not more, patients with the RK condition and other conditions that need an expert surgeon to address.